Hello, and welcome. Today we're diving into the world of gallbladder health to explore a condition called gallbladder sludge. It's a common issue that can sometimes lead to more serious problems if left unaddressed. So, let's uncover what gallbladder sludge is, why it happens, and what can be done about it. What causes this sludge to form? Gallbladder sludge primarily arises from an imbalance in the composition of bile. Bile is a fluid produced by the liver and stored in the gallbladder, essential for digesting fats. Several factors can contribute to this imbalance. Prolonged fasting or rapid weight loss are big culprits, as they reduce the frequency of gallbladder contractions, allowing bile to sit and thicken. Certain medications, pregnancy, and conditions that impair gallbladder function can also increase the risk of sludge formation. Think of it like a stagnant pond. If the water isn't flowing, sediment starts to settle. So, how does this sludge actually form and affect the body? The gallbladder's job is to concentrate bile and release it into the small intestine when we eat fatty foods. When the gallbladder doesn't empty properly, or when the bile contains too much cholesterol, calcium salts, or bilirubin, these substances can precipitate out of solution and form a thick, viscous mixture. This mixture is what we call gallbladder sludge. It can obstruct the flow of bile, leading to inflammation and potentially even more severe complications like gallstones. Gallbladder sludge is surprisingly common, but pinpointing exact numbers is challenging. It's often discovered incidentally during imaging tests performed for other reasons. It's more prevalent in people who are fasting, on total parenteral nutrition, or who have experienced rapid weight loss, such as after bariatric surgery. Pregnancy also increases the risk. While specific demographic data is limited, the underlying conditions that contribute to sludge formation provide some insight into who might be more susceptible. Now, what are the signs that something might be amiss? Many people with gallbladder sludge don't experience any symptoms at all. When symptoms do occur, they can be quite vague and easily mistaken for other digestive issues. The most common complaints include upper abdominal pain, often in the right upper quadrant, nausea, vomiting, indigestion, and bloating. These symptoms often occur after eating fatty meals. If the sludge obstructs the bile duct, it can even cause jaundice, a yellowing of the skin and eyes. How is gallbladder sludge diagnosed? The primary method is through imaging studies, most commonly an abdominal ultrasound. Ultrasound can visualize the sludge within the gallbladder as a mobile, echogenic material that layers within the gallbladder. In some cases, an endoscopic ultrasound or other imaging techniques may be used to further evaluate the gallbladder and bile ducts. It's important to note that simply finding sludge on an ultrasound doesn't automatically mean treatment is necessary. The clinical context and presence of symptoms are crucial. Gallbladder sludge isn't typically categorized into distinct types like some other medical conditions. It's more a descriptor of the consistency of the bile within the gallbladder. However, it's worth noting that the composition of the sludge can vary. It might be predominantly cholesterol-based, calcium-based, or a mix of different components. Understanding the composition can sometimes guide treatment decisions. So, what can be done to manage gallbladder sludge? The approach depends largely on whether the person is experiencing symptoms. If there are no symptoms, often no treatment is needed, and the condition may resolve on its own. For symptomatic individuals, treatment focuses on addressing the underlying cause. Medications like ursodeoxycholic acid can help to dissolve sludge by altering the composition of bile. In more severe cases, or if sludge leads to complications like gallstones or cholecystitis, surgical removal of the gallbladder, cholecystectomy, may be necessary. Can gallbladder sludge be prevented? In many cases, yes. Maintaining a healthy weight, avoiding rapid weight loss, and eating a balanced diet low in saturated and trans fats can help to promote healthy gallbladder function. Regular exercise is also beneficial. For individuals on long-term intravenous nutrition, strategies to stimulate gallbladder contraction may be employed. Ultimately, focusing on overall wellness and addressing underlying medical conditions can go a long way in preventing sludge formation. What's the long-term outlook for someone with gallbladder sludge? In many cases, the prognosis is good. Asymptomatic sludge often resolves on its own. Even when symptoms are present, medical management or surgical intervention can effectively alleviate them. Recent research is focusing on understanding the precise mechanisms of sludge formation and identifying new targets for medical therapy. While gallbladder removal is effective, researchers are also exploring non-surgical options to dissolve or prevent sludge recurrence. This will hopefully lead to better, less invasive treatments in the future.